these two types, there's
Which of these two types will need? Type 1, they need more insulin.
3 points. Woo! Explain. I'm not even asking my question, but you explain.
You and this guy,
No, Kamasa.
I think I told you.
Kamasa, this is the question I wanted to ask.
No,
I wanted to say
people die.
For this guy to finish your statement, you never know this one.
No. But I think he could preempt well. I'm just saying that in the treatment of this diabetes, for the type 1 and type 2,
Okay.
which of them do you think will need insulin as part of their
The
treatment?
treatment.
Especially from start.
I mean, that would be type 1.
That's the answer.
So that's the answer he gave. But you are right, but he gave this first. But so I explain why you're saying type 1.
Because they were not born with it or
Yes.
very little, so you need to push them.
So even if you give them medications, they may not work. Because it's not the medication they need.
Yes.
It's the insulin that they need. So yes, so the people will.
So small babies that will be happy.
Yes, so as you go, even 10-year-old, 9-year-old, you can have type 1 diabetes. And those people, they will need insulin. Okay, we will talk about complications as we move on. Yeah.
3 people die. I'm going to learn about them.
So the type 2, do you think that they just need the insulin? What is your opinion on it? Yes, Kamasa.
Type 2 don't need this one. Excessive and gross exercise.
Okay, we'll come there. Give him 1 point. There's something. Yes, what do you think about type 2?
I will not say they don't need it. Your question is good. You say they don't. They just need. It's not just need. They need it, but they need medication and control and gross exercise.
Okay, so with the type 2, they have insulin, but for some reason, the insulin is not very sensitive to the sugar to push it into the cells.
Okay.
You get my point? So based on what we discussed so far, I want you to be able to tell me some of the early symptoms of diabetes. So if somebody is about to have diabetes, there are some things.
Why you raise your hand?
If somebody is about to have diabetes, there are some things that are very clear. And then that's how they start. So everybody must pay attention to these things. So Kamasa,
Yes.
tell me some of the things that you think will start to happen.
You visit the urine now every 5 seconds.
3 points for Kamasa. Yes.
Move small, then you are tired.
3 points for Suarez.
You drink too much water.
3 points for Kamasa.
Look, can I say another one?
Yes, Kamasa.
No, you beat here, you don't get that.
Good. Another 3 points for Kamasa. So Suarez, you've mentioned about 4 symptoms of diabetes. Say all of them right now. Let's see. Kamasa, listen to it and let's see if he's right.
Listen to me.
He's the one who taught you.
You didn't teach me.
You were able to say 1. You
Yes.
mentioned 3 of them.
The people that died when they got the first symptom.
You were there.
Tiredness.
Good. So tiredness is one of the symptoms. Or easy fatigue.
Yes.
Easy fatigue.
Then early test.
So excessive test.
Test.
Hey, any test.
Then frequent
Urination. Good.
chop no start.
Yes, it's a good point. Back to my diagram again.
Yeah.
Where there's blood and there's what the cells and this was the sugar. What the insulin is supposed to do?
It's supposed to
Move sugar into the cell.
So that
it should give energy.
energy.
It should be giving us matter.
So if your insulin is not working properly, your sugar will not get into the cells.
Cells.
And then you always feel
Tired.
because there's no energy. That's why the tiredness will start. Okay.
Yes.
Again, now the body will interpret it. There is sugar. And it's not getting to the cells. So I don't have energy. So the body now begins to think. Is it that you've not eaten? What is happening? It looks like there is no sugar. I'm not getting sugar. Maybe the sugar inside is small. So let me make you eat. so that
you can replace.
you can put the sugar into the cells. So then you eat. After eating, what will happen? The sugar will come into the blood. Will it get into the cells?
No.
So then the body will interpret again. But this person is still happy. So what is happening?
Let me let him
Eat. Then you go and eat. And then what will happen?
more sugar.
More sugar, but it's not getting into the cells. So then you begin to eat a lot.
That is
And then never gets satisfied.
Satisfied.
Because the sugar is not getting into the
But then the cells that will produce energy.
energy for you. Do you understand? So that this explains why you begin to eat a lot. Because your body tends to think that you don't have energy. And you need more energy. So there's a lot of sugar inside. So the more you eat, what happens to the sugar? It builds up. And it's not able to get into the cells. So then the body is like, no, there's so much sugar in the blood. So let me bring some out for you. Through urine. Suarez 1 point.
No, wait.
No, don't use Suarez. Yes.
So when the sugar is too much, why would the brain know that there's too much sugar, but it's allowing the food to come? No.
It's a good question.
So I cannot answer.
Answer.
Because first it wasn't too much. First it was there. But
The insulin.
waiting for the insulin to go into the cell.
Yes.
Say,
But
maybe
yes.
you haven't had sugar, so I'm tired. Go and eat. Then you go and eat, and you get more sugar.
And then food
That
is
is
sugar is
building.
increasing.
Yes.
Yes. So now
But-
when it becomes plenty, the body now recognizes the sugar.
Yes.
Yes, because now it's plenty. If you have water and put small sugar in it, it's called diluted. If it becomes saturated, then we have what the last one is what?
I don't know. Maybe that is saturated.
Then we have the last one.
It's a lot.
We have a new condensation.
So
Now the body realizes that it's too much. He said, let me help you remove some.
through urination. So then what happens is that the kidneys is what produce urine.
Okay.
If you taste your urine, it's that.
Yes. So most of the time it is true. 1 point for science. So there's sugar in your urine. So sometimes if you urinate and then leave,
Ants will come around it.
Ants.
If you want the sugar,
yes. And the body, because there's a lot of sugar, the body wants to bring more out. So to help it produce a lot of urine, every time you are producing, because the sugar is there. What do you think will happen if you keep producing urine?
You tired and you want to
Drink more to replace.
Dog.
Yes.
So I'm asking, say, only sugar no system. Only drinking more of the water. Why you know they damage the sugar for the system?
Oh, yes, why don't attempt?
Yes.
Yeah.